Hey, I'm Dr. Gregg with Align Wellness Center, and I wanted to take a few minutes to show you what an adjustment is for a patient of ours that had a history of lower back pain that made it difficult for her to walk across town to her office, as well as affect many other parts of her life. I want to introduce to you our patient, Bridget. Hi.
Hi.
How are you?
Good, thanks. How are you?
Awesome. Can you share with us a little bit about what life was like when we first got together?
Sure. Lots of pain. It was difficult. I like to hike and ride bikes with my family, and it was difficult and painful, but I would get through it for the benefit of everyone.
So many people just grind through pain.
Yeah.
And they don't think that there's anything that they can wind up doing about it. Okay. You also shared our office with your daughter.
Yes.
What had you do that?
Well, she was having a little difficulty in school and just other kinds of problems, sports, concentration levels, so I thought it'd be a good idea to bring her in and see what we could do.
Awesome. What did you experience? What's your daughter experienced so far under care?
So far, she's doing better in school. She's remembering to get her homework done. She is learning more about sports, which she's very excited about, basketball and softball.
So she's getting involved in them?
Yes.
Super cool. Awesome. Well, why don't we show everybody what an adjustment is like for you
Sure.
to help with getting you back to life. We'll go
Sounds
ahead
good.
and have you lay down on your back. And for Bridget, one of the biggest things that we had to do is help with the curve in her neck, in taking pressure off of her spine and her nervous system and allowing the energy to flow right through. So I'm going to put a gentle force into her spine, and then we'll do it again. Now that helps to allow the energy from her brain to start to move down through her body. We're going to have her cross her arms, and we're going to do that in her mid-back as well, and have her flip over, and we'll do it through her lower back too, to make sure that every tissue, organ, and gland in her body can get the energy and strength that it needs so that it can not only work for itself, but so that it can heal and rehabilitate. So now I'm going to have you turn and face the equipment. Yep. Okay. Let's go back onto your stomach. Deep breath in and all the way out. Awesome. Now we're going to do a bit of a mirror image adjustment. This is a unique process we do that's based on the changes that have developed in her spine that were causing her to have the difficulties she shared with you. What we've done is we've shifted her hips up to her torso, or to her feet, and then her torso forward, and then her head back. We're then delivering an adjustment to wind up enabling her spinal cord to get through nice and easy so the energy can flow and provide strength and energy to her body. Bridget, why don't you go ahead and sit up for me? That's a great dismount the way that we teach it. Now, how was that adjustment?
Good. I feel a lot better.
Awesome. What would you tell to anyone who was going through some of the things that you did, just thinking that they had to deal with pains and aches as they went through their day?
I would say come in and get an adjustment, get yourself checked out, and see if it can help you too.
Super. And is it okay for us to share this with anyone everywhere?
Sure.
Awesome. Thank you so much. I'm super excited about how you've responded, as well as your daughter.
Thanks.
You're welcome.
All right.